Well, you're most welcome to today's video. Now, I want to look at an article that I've looked at from Medscape, which is a well-known online publication for nurses and doctors, and it's made a rather bold claim. It says, and I'll read it out, CDC says 44% of people with COVID who were hospitalized had a third or a fourth booster dose. So is this true? If so, quite interesting questions probably need to be asked. Now let's just look at this now. So here we see it here. This is from Medscape, and I put the reference there, of course, as we always put the references. Now it's saying almost half the people who were hospitalized with COVID-19 last spring had been fully vaccinated and received a third, or a fourth indeed, booster dose. Now this is coming from Medscape, so it struck me as being quite an extreme claim, and of course we have to be very careful on this channel that we abide by the community guidelines. So we have to go and look at the source of that particular reference. And here we see it here, and it is from the Centers for Disease Control, and that's the link to it there. You've put the link there, you can check it out. Laboratory confirmed COVID-19 associated hospitalizations among adults during SARS coronavirus 2 Omicron BA2 variant times, when that was predominant. This is what this is about, these hospitalizations. Now, the data is from the COVID-19 associated hospitalization surveillance network. Now, obviously, I'm not as clued into the US system of data gathering than the UK one. We know it's not actually as good in quite a few ways, unfortunately. But we do believe that this is highly valid data, and it's certainly with the source that the CDC is using itself. So data from COVID-19 associated hospitalization surveillance network. Date is 20th of March to 31st of May, when BA2 predominated. Now, among hospitalized non-pregnant patients, so they seem to want to differentiate between pregnant and non-pregnancy here, which is fair enough. 39.1% had received a primary vaccination series and one booster. In other words, they'd had 3 jabs. So quite a lot, really. 3 jabs, and 5% had received a primary series, that's the first 2, plus 2 booster doses, so that's 4 jabs. So checking the claim, that's 39.1% plus 5% is 44.1%. So this claim is absolutely true. Of the people hospitalized in the United States, in this collection area, in this collection time, during BA2 Omicron, over 44% had had a full vaccination dose plus a booster, or as in Mr. Biden's case, 2 boosters. And yet 44% of those were still hospitalized. Now we need to go a little further, but clearly this is pretty disconcerting data. So Medscape is correct, well under by 0.1%. Therefore, CDC advises, now this is CDC's advice, all adults should stay up to date with COVID-19 vaccination. So having said that 44%, just over 44% of people who were hospitalized with COVID-19 had had a full and a boosted or doubly boosted dose of vaccine, CDC then go on to say this. All adults should stay up to date with COVID-19 vaccinations. Sorry, my head was itchy then. So interesting. And also saying multiple nonpharmaceutical and medical prevention measures should be used to protect those at high risk for severe COVID-19 illness, irrespective of vaccination status. Now, what they're saying here is these people at higher risk need to be constantly protected. But I would like to ask the CDC, well, how long ago are we going to protect these people for? Because COVID-19 is now endemic. It's not going away for 10 years or 20 years. Are we going to protect them for the next 6 months, the next year, the next 2 years, the next 10 years, the next 20 years? This becomes, to my mind, completely unrealistic. And I would have thought there's a place for natural immunity here. But CDC don't mention natural immunity, but natural immunity, let me assure you, exists. It exists. But they don't seem to mention that, unfortunately. So why are they recommending this? Unvaccinated adults were 3.4 times more likely to be hospitalised with COVID-19 than those who were vaccinated. So they are saying there's clearly protection here. But still, over 44% of the people who were hospitalised had 3 or 4 vaccine doses. Also in this CDC report, hospitalisation rates amongst age 65 and over increased threefold, and hospitalisation rates basically in the 18 to 64. So they take 2 age ranges here, 18 to 49 and 50 to 64. Both increased 1.7-fold during the Omicron surge. Of course, obviously, because there's just so many people who have the infection, obviously, even if it's a very small percentage. I mean, we know in the UK data at one point there's about 1 in 15 people who actually had COVID in any 1 week. We know this has just been massive, so it's not surprising that with huge swathes of the population infected, that a particular proportion would be hospitalised, of course. So quite why the CDC, maybe they're not surprised by it, maybe they're just reporting it. So not surprising at all. Now, we have to abide by the guidelines, so YouTube guidelines. We can't say anything about vaccine safety. We're not saying anything about that, so we agree with the community guidelines on YouTube, of course. There's only rare side effects that are recognised by health authorities. But even these rare side effects that are recognised by health authorities, you could argue, alter the risk-benefit analysis of vaccination. I'm not sure the CDC is fully up to date with that, but I'm always happy to talk to them, of course. Efficacy of vaccines. I can't post content claiming that vaccines do not reduce transmission or contraction of disease, and of course we're not claiming that in this video. Also, claims that there is a guaranteed protection method for COVID-19 and claims that any medication or vaccine is guaranteed as a prevention method for COVID-19. Now, of course, we agree with this wholeheartedly. There are no, well, there's very few, well, there's only 2 guarantees in this life, isn't there? Death and taxes. They are completely right that these guidelines say there's no guarantee. So it's saying no drug or vaccine gives guaranteed protection. We agree 100% with the community guidelines, and this illustrates it. In fact, this shows that hospitalisation is 44% of people were fully vaccinated who were admitted. So that really substantiates these YouTube guidelines. Claims about COVID-19 vaccine that contradict expert consensus from local health authorities. So we're being careful to quote data from the CDC, which of course is the national authority. Claims that an approved vaccine will cause, well, we're certainly not claiming that on this video. Claims that COVID-19 vaccines do not reduce the risk of serious illness or death. We're not claiming that. We're merely saying that 44% of people who were hospitalised during this BA2 period of Omicron in the United States had 3 or 4 doses of vaccines. So hopefully you can see the differentiation I'm making there. So there we go. Not particularly good news for the vaccination programme, while we could still, of course, agree with all the YouTube community guidelines and don't want to spread disinformation. So this is straight from the CDC. That's the main thing I want to say today. But I think just before we finish, we'll look at New Zealand, which is interesting. We've covered New Zealand from time to time on these videos. Let's just look at it now. Basically, New Zealand has dropped the pandemic. They've said basically everything's back to normal. The only thing that you still have to do now is to isolate if you're diagnosed yourself. Prior, the whole household had to isolate. So not quite sure why the New Zealand authorities are still doing that. We dropped the legal requirement for that in the UK a long time ago. Nevertheless, this is the New Zealand government. The approach of the Ardern government has been, some would say, controversial. Anyway, deaths so far in New Zealand, 1,950, but nearly all of those have been this year in the Omicron wave. And this, of course, is not that Omicron is more deadly, it's that New Zealand was protected because it's an island and they didn't have any COVID-19 for very long periods of time as they restricted international travel. So you could that's good, because the Delta was more deadly than the Omicron, of course. Hospitalizations, which is their key metric, down sharply in recent weeks. Now, of course, the testing is pretty patchy in New Zealand, virtually, well, it is everywhere now, isn't it, of course. So they're using hospitalisation as the key metric, rightly. That is the right metric to use. I don't really care how many people get infected with COVID-19, if it's mild or asymptomatic. What I do care about is people getting sick and dying. That's why we keep doing these videos and other health-related matters. We want to improve, give people the information to think for themselves and to improve their own health, we hope. So that's correct. Using that indicator is the correct indicator. Today marks a milestone in our response. Prime Minister Ardern, is it Prime Minister in Australia or in New Zealand? I do apologise. I think she's the Prime Minister of New Zealand, whatever she is. So apologies to New Zealand for my political ignorance of your systems. Finally, rather than feeling that COVID dictates what happens to us, our lives and our future, we take back control. Well, actually, I don't really think it's any human beings taking back control. I think it's the fact that the wonderful mechanisms of our innate immune system have allowed hospitalization rates to go down. But if she wants to claim credit for that, then yeah, she's a politician. Politicians claim credit for all sorts of things. So I would give credit to the immune system. She gives credit to her taking back control. Fair enough. Mask wearing only compulsory in healthcare settings now, but it had been largely ignored anyway outside Wellington, apparently. End of vaccine mandates for workers, inbound travellers. Vaccine mandates were somewhat draconian in parts of the world, but they're being lifted now. End of vaccine mandates for workers and inbound travellers. Tests on arrival in New Zealand are now not mandated, but they are encouraged. COVID positives still required to isolate, but no longer household contacts, so just the person that tests are positive. Jacinda Ardern again, this will be the first summer in 3 years where we won't, where there won't be the question of what we will and won't do being cancelled because of COVID cases. Good. So looks like basically the New Zealand government is realising that we are moving into endemicity now, and COVID is everywhere, and I took my poster down that says "Stop COVID-19" long time ago. Now, people are always criticising me for things I said 18 months ago or 2 years ago. I make no apology for this at all, because we go with the evidence, and the evidence changes. So the whole point is to make decisions based on the most up-to-date information we have, so that we give ourselves the best chance of optimizing our health. So that's where we are now. That's my interpretation of the situation. Sorry about the extraneous noise. We're working in the field this week, but thank you for watching.